Esposito. I'm a pediatric orthopedic surgeon at the Children's Hospital and Medical Center in Omaha, Nebraska.
I'm Mary Peterson-Surrey. I'm an emergency medicine physician in Pinehurst, North Carolina, and the mother of 2 children with osteogenesis imperfecta.
And we're going to do a long leg splint as we would for a child that had a femur fracture. And this can be adapted depending on where the child's injury is, to a short leg splint to a long leg splint. We're using a pre-packaged product, which we think is a reasonable thing to use to have for a family with a child with OI, because it's something you can store, it has a shelf life, and it's easy to use.
So when a child has a fracture, you want to try to keep them calm, you want to try to make sure you get all the medicine on board, give it an appropriate amount of time to work, and then begin to apply the splint with another person to help you.
So the first thing we do is just make sure the child's comfortable, and one individual will just hold the extremity steady, and a little bit of gentle traction on the leg oftentimes helps. We generally will allow the knee to stay flexed. Ideally the foot's up so that the splint will stay on better, but if the child's more comfortable with the foot down, that's okay. The main thing is to make sure the splint's long enough, and one of the big problems we see from emergency rooms and people trying to splint themselves or their children is that if the fracture is here in the middle of the bone, the splint will end at the end of the bone. So one of the things we're going to show today is extending this all the way up to the nipple line, understanding that if you try and get it up to the nipple line, you'll probably end up by the umbilicus, which is okay because you just want to make sure the joint above and below is immobilized.
Once you open this package, you have to be ready to go immediately because it will begin to harden.
And while she's getting the package prepared, that your helper is always keeping the baby calm and holding the leg straight or in a position of comfort.
You can measure what size you need on the unbroken leg and just get a rough estimate. Go about right there.
And then cut it to length, understanding there's going to be some rough edges here that you can pad later on after the splint gets hard.
You can also peel and roll it down. You want to put the padded side against the baby.
And down along the outside of the leg, just down underneath the buttocks a little bit. And generally we'd be wetting this because it helps to set it faster and smoother.
And you wrap from the bottom.
All the way at the base of the toes so it doesn't swell beyond the wrap. And one of the things we generally do and recommend is that you use one wrap on the leg and a separate wrap up around the waist if you can. For demonstration purposes today, in this child who's normal, we're just going to gently lift up on the buttocks, making sure we don't hyperflex the spine because the spine's at risk in these children. So one of the things that's really important is to have 2 people doing this to hold the child's leg steady. And once we get the splint on and wrapped loosely with the ACE wrap, then we allow it to get hard. As it starts to harden, then it's a matter of just holding the child's leg still and using the palm of your hand to kind of mold it. And in an infant, what we'd be doing ideally is then, once this starts to get just a little bit firm, put the child in their car seat, and the seat will hold the hip in a flexed position, knee in a flexed position, help mold the splint. And the kids are usually a lot more comfortable too when they're in that position. And don't worry about how neat you make the ACE wrap look the first time, you just worry about getting it on and making the splint smooth so the baby's comfortable.
You can always rewrap later when things have calmed down.
And that's basically the position most of the children seem to be most comfortable in. If their hip and knee are flexed a little bit, it relaxes the hamstrings and it helps cut down on the spasm. This kind of a splint can be used for anything, even an arm. You can bring it up around the top of the shoulder, down around the elbow. The principle is always the same. You want to make sure the joint above and below are immobilized, that has a nice amount of padding, and you can get this padding either in foam or in a felt material, and it tends to dry out.
The diaper would normally not be on when you splint the child. You would put the diaper on after the fact, and that way you would have less problems changing the diaper and using that afterwards.
And if you use 2 separate ACE wraps, one around the chest and waist and the other on the leg, that seems to work.
And if you have an accident, it's easier to change out the ACE wraps.
And what type of pad was it, Mary, that you recommend?
It's a poise pad you place in the diaper, and that way you're only changing the diaper when you have a stool, which decreases the movement and allows less pain for the child.